I grew up here in Green Bay. I was born at St. Vincent's. I obviously did my stint in the Navy when I wasn't here, but otherwise, it's pretty much for the most part been here in Green Bay. I was a runner in the area and kept getting injured, and I would go to the hospital, see the surgeon, kind of go over what was my injury and what was going to happen. At the time, I thought, well, I'll be a physical therapist because they get to work with athletes all the time. And after visiting with the surgeons over and over again, I'm like, well, maybe I don't want to be the therapist. Maybe I want to be the surgeon. There was a physician in particular that worked with me when I was in high school and with my injuries. His name was Dr. Walkwitz, a very good local surgeon who's now retired. And he just had a very nice approach with his patients. I was just a kid, but he made me feel like I was important and he cared about my injury. So I take that same approach with my patients. I try to listen to what they're saying and what they're not saying at the same time. So if I got a motivated person who really wants to get back out there, I'll try to work with them to get them back on the field. I started my training at the Medical College of Wisconsin down in Milwaukee. After my 4 years there, I joined the Navy and went out to Portsmouth, Virginia to finish up my residency in orthopedics. Once that was completed, I then joined the Stem and Philippon Research Institute and did my fellowship in sports medicine out in Vail, Colorado. I'll go to conferences to learn about new techniques. I have some really good vendors that I work with. I spent a lot of time down in Naples, Florida, learning kind of the newest techniques that are coming out, new implants, things that will make the same surgery just better. My patients can recover more quickly. I get the comment a lot when I come into the room that I have a lot of energy. So, especially in the mornings, if folks are still pretty tired, 8:30, and I'm ready to roll. I've had a couple cups of coffee and I'm ready to roll and take care of my patients. And so the energy level that I'm bringing into the room, I've gotten a comment on that quite a bit. I'm a Christian. I want to take care of my patients to the best of my abilities, make sure that they can get back out there. And I really try to take that empathy and compassion to my patients. I really feel like there's a connection there then with your patient to make them get better. Still a runner. I like to get out there and run, exercise. I feel like that's a really good way of keeping yourself fresh. But also, my brothers up here, we love to hunt, do that sort of thing. Mike Schnellbelt is a good friend of mine. I met him when I was working in Green Bay previously and got a call about 6 months ago that they were looking for an extra guy who has the same level, the talent, skill level that I have. And came up here, met with the team. I had a really good experience and couldn't wait to be a part of it. I love my job. I love coming into work. It's because of the variety of it. I get to take care of, traumatic injuries. Somebody's having the worst moment of their lives. I get to be there and help. Or I get to get that athlete back out on the field, and seeing them back out there for the first time is very rewarding. So it's really, I get to see almost an instant return on the work that I've done for my patients, where instead of managing something that's just not going to get better, it's fixed, and maybe I don't see them ever again, but I know that they did well and they're back to their lives.